Hello, everyone. My name is Rachel Warner, and I work for the Nevada State Immunization Program as the School and Child Care Immunization Coordinator. I've put together a training to go over the annual school immunization survey that NSIP asks all of the schools in Nevada to complete. And here is the Nevada Division of Public and Behavioral Health's mission, vision, and purpose. So we'll just take a quick look at that. Okay, so here's a quick agenda of what we will be covering in today's training. First, we will review the Nevada school immunization requirements. We will then talk about what the state asks schools to report on each fall and the reason behind why the state collects those vaccine rates. We will touch a little bit on School VaxView, which is a CDC resource, and also talk about the school report cards that the state put together over the summer. And then finally, we will actually go through the school survey questions in detail to hopefully answer any questions that you might have. There are immunization requirements in place in each state for children to enroll in a public, private, or charter school. Nevada specifically has these requirements outlined in various Nevada revised statutes, NRS 392.435 and NRS 394.192. If you are interested in reviewing these NRS regulations in a bit more detail, they will be accessible via the resources I sent out with this training. Just to do a general overview of the vaccines required for school enrollment in Nevada, there are requirements for incoming kindergarten, 7th, and 12th grade students, as well as requirements for university students. For kindergarten students, the vaccines required will be DTaP, which protects against diphtheria, tetanus, and pertussis, IPV, which is inactivated polio vaccine, MMR, which protects against measles, mumps, and rubella, hepatitis B, varicella, which is commonly known as chickenpox, and hepatitis A. For 7th grade students, the vaccines required will be Tdap, which again protects against tetanus, diphtheria, and pertussis, and MenACWY, which protects against Neisseria meningitidis, which is a form of meningitis. And for 12th grade students, the only vaccine required will be MenACWY. This requirement is for a student to receive a dose of the MenACWY vaccine on or after 16 years of age, which is a newer requirement as of the 2022-23 school year. We'll expand more on that in later slides. There are no immunization requirements for homeschooled students. However, if a homeschooled student does any on-campus school activities such as sports or other extracurriculars, they would have to show proof of immunization or an exemption to that school in order to participate in school activities. There are also requirements for any child enrolling in a child care facility, but for the purpose of this training, we will just be focusing on school immunization requirements. And here on this slide is the Nevada school vaccine schedule. So you'll see the vaccines we already mentioned: DTaP, polio, MMR, hepatitis B, varicella, hepatitis A, Tdap, and MCV4, which is also MenACWY. And that one is highlighted yellow because of the newer school requirement for incoming 12th grade students. They just need that additional second dose at 16 years of age. As a little bit of background, we ask schools to report on their enrollment numbers, up-to-date vaccine rates for kindergarten, 7th, and 12th grade, number of religious and medical exemptions, students who are conditionally enrolled, and students who are non-compliant. We ask for this information to be submitted every year. The surveys open up in September or October and close December 31st. For the past few years, this has been in the form of a survey through an online program called REDCap. We are still using REDCap, but we have worked on updating the school rate reporting survey to make it a little easier for the school nurses and administrators who fill it out to respond to the survey questions. These school immunization rates are important to collect for a number of reasons. First, all 50 states submit their kindergarten rates to the Centers for Disease Control and Prevention each year, as the CDC asks for kindergarten immunization rates each spring. They use this information to compile visual graphs and charts on their resource, School VaxView, which is a free online tool that anyone can view school rates in each state on. Another reason we track school immunizations is in the case of a vaccine-preventable disease outbreak here in Nevada, we would be able to narrow down specific counties or zip codes with lower up-to-date rates within the schools, and schools will also exclude any students who are not up to date on their vaccines. In addition, we collaborate with the Nevada Department of Education to discuss school immunization rates and how we can work together to improve school rates throughout the state. This slide has a couple of screenshots that I pulled directly from SchoolVaxView. In the photo on the left, you'll notice a map of the United States with different shades of blue. This map is showing DTaP coverage among kindergartners for the 2020-2021 school year among all states. The darker the shade of blue, the more kids are up to date on DTaP, and the lighter the area, the less coverage there is for DTaP. You'll see, if you look at Nevada, that Nevada is that darker blue color, and if you look at the legend, you'll see that this color shows coverage between 94.4 to 95.7% for DTaP. You can select any kindergarten vaccine to view the data in a similar map on the website. So you'll see there that you can select which vaccine to look at in more detail. I, of course, selected DTaP, but you can select any kindergarten vaccine. You can also look at each state closer, and you can also view it by different school years. I find this really helpful to be able to compare the coverage rates for certain vaccines state by state in this type of visual view. If you focus your attention to the screenshot on the right, you'll see Nevada kindergarten immunization rates from 2011 to 2021, so over a 10-year period. This graph looks at 5 kindergarten age vaccines: varicella, DTaP, hepatitis B, MMR, and polio. You'll notice for most of the vaccines there was a drop in school year 2016-2017, but we then saw them increase again in the following school years. Again, if you take a look here on the left, you can deselect specific vaccines if you only want to view this graph one vaccine at a time. You can also view multiple states on this, and you can view this with different school years as well. And this here is why it's so important to get our state-level kindergarten immunization data to CDC each spring, so that this resource can continue to stay updated for the general public to view and to see how we're doing state by state and overall as a country. Another reason we collect school immunization rates is so that we have an idea of how individual counties and schools are doing with school vaccine rates. And this year, we created school vaccine report cards for each county. We included all of the up-to-date vaccine numbers, and we also included data on exemptions, conditional students, and non-compliant students. These report cards were sent out to all of the chief school nurses, the Nevada Department of Education, the School and Child Care Task Force that Immunize Nevada hosts, and other key partners we identified that would benefit from viewing this county-level data. In the case of a vaccine-preventable disease outbreak, it's also important to know which schools may have higher rates of religious exemptions and lower up-to-date vaccine rates. Say, for instance, we were to see a measles or pertussis outbreak somewhere in Nevada. If this were to happen, we would identify the schools that are more at risk, and those schools are required to exclude any students who are not up to date on the immunization that protects against that disease. We would also provide immunization resources to those schools that they can give to parents. Each of the 17 counties' report cards were sent out to the appropriate school nurses across Nevada, but if you don't have access to your county's report card or are interested in viewing other counties, please reach out to me directly and I can send you those to review. So before I get into the actual survey questions, I just want to cover some common immunization rate reporting definitions that we encounter a lot here at NSIP, and especially in the school vaccines world. I'll be using these terms more frequently throughout this presentation. First, up-to-date, or UTD, means that students have all of the doses of the required vaccines for school or childcare entry. We would not include students with an exemption or who are behind on their immunizations when we report these up-to-date numbers. These students are considered in compliance. Conditional enrollment, or sometimes known as provisional enrollment in other states, means that the child is not currently up to date on all of their vaccines, but they are in the process of completing the series of shots. This may be because the student was behind on their vaccines and is completing a catch-up schedule. This happens a lot when the student just moved from another state or another country. So as long as the student can show proof that they are in series to get their vaccine or vaccines complete, the school has to accept that, and the student should not be excluded from school. And they're given 90 days to complete the series. One other term we see often is non-compliant. This means that the student is not up to date on their vaccines, they're not considered conditional, and they don't have any medical or religious exemptions on file. When a student is non-compliant, they are excluded from school and can only return when they get vaccinated or file an exemption. And just as a reminder, Nevada only has medical and religious exemptions for schools. So most school nurses should be quite familiar with all of these terms, but we still include definitions of these in the rate reporting packets we send out each year, just in case they need to brush up on them. And one caveat I want to mention is that the exclusion of students who are not up to date on their vaccines does not apply to students who are experiencing homelessness. This is because of something called the McKinney-Vento Act, which is a federal act through the United States Department of Education. This act basically states that a student experiencing homelessness has the right to immediate school enrollment, even if the student doesn't have proof of required immunizations. Once the student is enrolled, it's the responsibility of the homeless education liaison at the school to help the student or family obtain the necessary records or immunizations. Okay, so now that we've done some background on how and why we collect immunization rates, I'll now go through the school survey and what that entails. Hopefully this helps answer some questions you all may have on the immunization reporting process. The first page of the survey is just questions about who is filling out the survey. So we ask for name, job title, phone number, and email address. Then we start to ask questions about the school you work for, so indicating whether it's a public, private, or charter school. And based on what option you select, the next drop-down box will only show you the schools within the category you chose. Again, public, private, or charter. This drop-down menu also separates the schools by county name, and everything is alphabetized, so they should be easier to find. If you don't see your school listed, there is an option to write in your school name if you select Other at the bottom of the drop-down box. You then fill in your school's address, city, and zip code. The survey will then ask you if your school has students enrolled in kindergarten. If you select yes, you will be directed to the next page to fill out your kindergarten vaccine information. And if not, you will be taken to the 7th and 12th grade sections of the survey. So if your school has kindergarten students, you will fill in this section of the survey. First, we define up to date at the top of the page. UTD is when a student is up to date on each of the vaccines listed. This means that they have all of the required doses at the proper time intervals. You would not count students who have any exemptions, medical or religious. You would not count any conditionally enrolled students or non-compliant students in those UTD counts. The first question is just asking your total kindergarten enrollment number. You'll answer all of these questions as of September 1st or the first day of school, whichever comes first for your school. The next questions after this are asking specific up-to-date numbers for each vaccine required for kindergarten enrollment. So there will be 6 vaccine-specific questions, 1 for each vaccine required. DTaP, polio, hepatitis B, hepatitis A, MMR, and varicella. Again, please only count students who have all of the required doses of each vaccine, not students with exemptions or who are conditional. The next set of questions asks about medical exemptions and religious exemptions. The first one is asking how many total students have a medical exemption from any required vaccines, while the next ones ask about vaccine-specific medical exemptions. It's pretty much the same type of questions when you get to the religious exemption section, although there is one question at the end of the religious exemption questions, which asks for total number of kindergarten students exempt from all required vaccines. This is where we would like to know, of the students who have religious exemptions, which ones have exemptions for all vaccines. So this number may be the same as the above questions, or it might be lower, but it would never be higher. Number 6 asks how many kindergarten students have documented varicella disease, if you have any in your school. Question 7 asks how many kindergarten students are conditionally enrolled. Again, this means that the student does not have the required vaccines due to the minimum age requirement and or dose intervals, but they're in the process of completing their series of shots. Number 8 asks how many kindergarten students are non-compliant. Again, this means that the student does not have the required immunizations, they don't have a signed medical or religious exemption form, and they're not considered conditional. This means these students would be excluded on the first day of school if they couldn't show proof of immunization. Just as a note, when you are inputting all of these numbers, the total number of kids up to date on each vaccine, plus students with an exemption, plus conditionally enrolled, and plus non-compliant, should all be no larger than the kindergarten enrollment number. Kids with an exemption should also not be counted in the conditional enrollment category or the non-compliant category. Essentially, each category is separate from one another. So if you have any questions while filling out this section, please don't hesitate to reach out to us at NSIP or to me directly, and I can help you with the survey. At this point, you are finished with the kindergarten section of the survey. So now, if your school has 7th grade students, you will go to the next page to fill this part of the survey out. This 7th grade section is exactly like the kindergarten section, but just with 7th grade students. So again, you'll see number 1 is asking for your total number of students enrolled in 7th grade. The following questions are those vaccine-specific questions, but for 7th grade. So it'll ask you your up-to-date numbers for men ACWY, varicella, Tdap, MMR, and hepatitis A. And then it'll go on to the medical and religious exemptions. So if your if your 7th grade students have any medical or religious exemptions, you would fill that part out. And of course, then it goes down to how many 7th grade students are conditionally enrolled and how many 7th grade students are non-compliant. And again, I'm just emphasizing this once more. Number 6 and 7 should be separate categories from your up-to-date numbers. So these number 6 and 7 would not be considered up-to-date students. And then the last question is just asking if you have any 12th graders enrolled. So you'll go on to the next part of the survey if you do. If you don't, you'll finish the survey here. Okay, and here's the last section of the survey, which you will fill out if you have 12th grade students at your school. And this part of the survey is very similar to the kindergarten and 7th grade section, so by this point you should all be familiar with the questions there that are being asked. Again, number 1 is asking for total number of students enrolled in 12th grade. The following questions are vaccine specific, so total number of students up to date for men ACWY, varicella, Tdap, MMR, and hepatitis A. Again, going over medical and religious exemptions for 12th grade students and any 12th graders who are considered conditionally enrolled and non-compliant. And then the last question here wraps up the survey. So it asks, if applicable, what back to school or end of school year vaccine opportunities did the school or district provide? And we just ask this because we are interested in knowing if your school or your school district offered any back to school vaccine opportunities, like what kind of opportunities those students received in the weeks leading up to school starting, just so we have an idea and if we need to be able to support different districts going forward. So again, this wraps up the survey for you. And here's an acronym slide for you with just some terms that I talked about today. So if you want to take a screenshot or pause this training to capture this, feel free to go ahead and do that right now. And if you made it this far in the training, please send me an email with one thing you learned while watching today's training. It doesn't have to be a big thing. It can just be 1 or 2 things you might have gained from listening in on today's training. And my email is going to be on the next slide for you. Thanks. And here's my contact information on this slide. Feel free to reach out if you have any follow-up questions after watching this training. I'm always here for support and to help you through this rate reporting process. And this wraps up the training today. I just want to thank everyone for taking the time to listen, and I hope you have a wonderful day. Thank you.